Hi, and welcome to this curriculum series specifically about advanced pharmacology curriculum integration into NP training. Okay, this is part 2 of a 3-part series, and I'm Dr. Bustai, and you're probably watching this because you are a decision maker or you're involved in academic training of the NPs, curriculum development and maintenance, or you might even be a preceptor training NPs in the clinical environment and wanting to make sense of this. Okay. In part 1, we started to establish the rationale for why change needs to occur and why it's imminent. Okay. I would recommend that you do listen to that because it becomes very important and part of the design of a curriculum that's not only good for today, but in the future for NP training. Part 2 here is, where are the new AACN Essentials guidance document leading, right? Leading in the profession, but leading also in the training of NPs. That's our focus. So remember, we talked about how do we go from thinking kind of in the old way of doing things where we have courses and those courses are confined and we leave them right there. And then we move on to other courses where the first year of NP training is really about, didactic work, the 3 Ps, pharmacology, we got pathophysiology, we got, your physical examinations and those kind of things. 2, then you move into your year 2 training, which is your clinical work, to thinking about advanced pharmacology in a more comprehensive, integrated, and longitudinal format. Okay. Well, I like this, again, diagram or infographic to kind of help us wrap our minds around what we're trying to accomplish and what the AACN Essentials are trying to accomplish, but it's not complete, right? So we're going to be building on it. So where is this important document that was published in 2021 with a 3-year expectation of being rolled out into NP programs? Where is it leading? What were the sort of take-home points as it relates to advanced pharmacology in particular, right? So I can't talk about all of the document. It's a very well-written document. Was very impressed with it, but we're going to be focusing our attention as it relates to advanced pharmacology. So if you look, I took key components of it, trying to highlight some important points, okay? Because again, they're establishing a roadmap, and these are some of the core competencies for the profession moving forward. They want to move from a situation where you have sort of a time only, you do this, you spend this much time studying something and you're competent, versus you go to competency-based education. So time-based, which is the old way of thinking and doing it, to competency-based. So competency now implies that you have a different level of understanding, right? I think we assume that if you spend the time studying that you are therefore competent, but is that really true? Okay. And I think that's where the goal and the shift has happened here. And it's an important one because it influences in your curriculum, not only the design, the integration, but the evaluation, right? How do you determine somebody has achieved a certain degree of competency? What kind of experiences do they need to be having to demonstrate that they are competent? Okay. Especially for not only the current, but the future generation of NP practice. Well, when you break down some of the biggest changes that have to happen in a nursing curriculum, that's this statement up here, there's a couple things that I want to point out. First is that, again, we're transitioning to competency-based assessments. So students are going to need to prove at some level they understand how to apply the information, hopefully in the real world setting, right? That may also be on tests or quizzes and things like that. But they have to be able to demonstrate that they understand why they're doing what they're doing, not just picking the right answer, okay? Secondarily, students have to have multiple learning experiences across increasingly complex environments and situations. And the performances, therefore, are also going to be adjusted as it relates to that. So yes, we can use multiple choice tests to help us to objectively measure a certain degree of competence and understanding, but it's going to have to go beyond that. And again, that's where we assess people in the clinical environment, seeing how do they interact with patients, how are they applying the information, okay? So this becomes very important to the approach to assessment, but it also becomes important how do we train them to think like that. Okay. So, but rather than having just a course that's standalone, they're now advocating that this needs to be integrated across the entire curriculum. And you're like, how do I teach advanced pharmacology throughout the entire curriculum? And it sounds confusing, it sounds daunting, especially when you have all these components that you have to build into it. But that's why we're here at High Yield, right? We partner with institutions. We've been doing this for over a decade to make it easy. We have a program of success that many institutions already are using and already can do this right now. And that's why we're doing this for you, because we want to show you how we can help you, not just to do your job, but also to invest in the next generation of NPs. Well, when you look at the courses that they focus on, they do talk about the 3 Ps. That has not gone away, right? The 3 Ps being, again, when you look at pathophysiology, physical assessment and examination, you have advanced pharmacology. That stuff has not changed at all, okay? So it says it does not change this requirement that even goes back to the 2008 standards for regulation of accreditation, okay? So that's still there. So, but when you dig deep into some of this language, we don't have time to go through all of it, but when you dig deep into some of the minutia of what they're talking about as well, we're going to pull it together here, but they're talking about an advanced pharmacology curriculum that is comprehensive and sufficient. Okay. Secondarily, you've got to incorporate new things, new components, new essentials of advanced pharmacology, things like pharmacogenetics, pharmacogenomics, that just sometimes even the words seem confusing if you're not used to it. But it is happening right now, and it is definitely the future. You have to incorporate evidence, this thing called evidence-based clinical practice, evidence-based medicine, evidence-based practice, whatever term you want to use. Evidence and why are you doing what you're doing versus me just telling you and assuming that I'm telling you everything to be correct. You have to know where the evidence comes in its proper context. Wow, that's hard to do sometimes, especially if you weren't trained to do that and you haven't developed a curriculum that already has that in. Again, that's where resources like at High Yield Med Reviews comes in handy. We've built it strategically in. That's our model and has been our model from the beginning. So that's why Essentials works great with us, because we already are like, we've been doing that, right? And that's why we want to reach out to you and show you how this can be done, because we've been doing it, right? But you've got to have a longitudinal, comprehensive, integrated approach to teaching advanced pharmacology. So how can this be done? And what does that then kind of look like? Well, when we think about evidence-based practice, because that's all over guideline statements, accreditation standards, it's in your milestones, it's in your curriculum. Everywhere you see it, it's permeated throughout the healthcare system in numerous ways. And it's not just nursing, but it's also in pharmacy and medicine, okay? So when we think about evidence-based medicine at its core, like what was it by the EBM working group going back from 1992 when they established and sort of defined some of this? So it's saying taking the best available evidence on a particular question or clinical scenario, you combine it strategically with your real world experience, right? So that's the clinical expertise. You can't just read books and know how to take care of patients. There is the practical application of this in the clinical environment that we all respect and know, don't we? But there's also patient-specific factors. And when all 3 of those components in equal distribution come together, you have an evidence-based practice, okay? So they all have to exist. But is this really the goal? This is traditional teaching of EBM and its core components. But I actually think it looks more like this. So when we talk about best available evidence over here, our clinical expertise, and our patient-specific factors, but wait a minute. There's a process of learning how to do those things at each level. How do you assess the literature? How are you learning to apply the information? How do you interact with patients? And that comes in our nursing education, doesn't it? So the curriculum itself becomes key and essential to being a part of this thing where we develop not only clinical excellence and have a system that is evidence-based practice in nature, but where it's all coming together in balance. Okay, that's why Venn diagrams are what they are. They're talking about an influence by independent components, but in an equal distribution for the most part. Okay. So now you have to start thinking about it kind of like this. I've got to now think about advanced pharmacology just like we traditionally used to think about it, but now I'm thinking about evidence and being incorporated into it so that I know why I'm doing what I'm doing. So we added another dimension to our infographic here to point out the evidence-based process that's also longitudinal. And you see the word tiered based, tiered being based on the level of training, because as we progress, our knowledge begins to solidify and grow, doesn't it? So we need to adjust what we're teaching to people at strategic elements. So we're going from time-based to a competency-based system, okay? And then we're creating sub-competencies in these other areas of pharmacogenetics and genomics and evidence-based practice that have to be considered, okay? So when we start talking about competency, we have to think about how are we going to measure this, right? Is it just being able to pick the right answer? I know a lot of people that can answer a lot of multiple choice test questions. They're great test takers. But when I put them out into the real clinical environment and I start asking them very relevant clinical questions, they freeze. They have a hard time applying it. So just because you memorize something and can regurgitate it on exam doesn't necessarily mean that you understand it. So having a curriculum and resources that teach people to understand will allow them to understand the concept that they can then apply it to a test question because they have to pass tests for licensure and getting these advanced credentials that we need, but that also translates into the clinical environment, right? So knowing just the right answer is important, but knowing why it's the right answer is even more important. So what is the type of NP that we are trying to create? Because it influences the design and the content and the structure and the integration of the curriculum. The iceberg phenomenon here is great analogy. So we have a model that we use called knowledge transfer at High Yield Med Reviews. Okay, when we talk about explicit knowledge, that's very early on in our training, right? When we're learning the drug names, the drug classes, the mechanisms, basically things you memorize, they're facts. But we all know that every day when we're making decisions, there's a depth to that. It's the stuff that you can't see. It's the understanding, it's the why, it's the how. And that's your tacit knowledge. And that's where that clinical competency really starts to go. So if you don't dive down into that area, then you're going to potentially compromise that. So what do a typical advanced pharmacology courses for NPs look like? Well, they're usually a 2-3 hour course. There's variations to that, obviously, but it's typically in a 1 semester course and it's done. There are a few programs that do 2 semester courses. I think that's the right thing to do because it's just too much information to cover, but typically that's what it is. They usually have a paper, they start doing cases, or a single case presentation. Okay, that's the traditional. But the problem is if you're trying to fit it in a 2 or 3 hour course where you're confined to the amount of work that you can expect on a student, and you now know that we have all these other essential components to build in. So not just the core of drug interactions and evidence and pharmacokinetics and dynamics, but we've got an aging population. We've got comorbidities that are increasing. We've got biosimilars, biologic agents coming out to the market, new drugs every day. We've got system-based considerations, insurance policies, preferred drug lists. All these things add up. And again, it becomes overwhelming, but you get a bottleneck phenomenon because you can't shove it all into one course. And that's where the AACN Essentials core competency documents, in my opinion, have done a great job of really trying to move the profession forward to this integrated longitudinal because that's the way it should be. If you don't do it, there are obviously going to be some ramifications. And what are those? Well, one is the content will have to become less comprehensive, okay, and less sufficient. Well, we know that that's potentially a problem. Or if you squeeze it all in, you're going to have to cover it at a much more basic level. If you keep it confined in the old ways of doing it, you're going to have to cut it down so much that it's basic. But are you real now teaching advanced pharmacology? Are you really preparing the nurse practitioner students for the current and the future practice? Probably not, because you're running out of time. Remember, this advanced pharmacology curriculum has got to incorporate things in a comprehensive fashion that integrates all of these essential components across the entire curriculum. So that all sounds good, but the obvious problems that we all face as you're sitting here listening to this and you're going, yeah, Dr. Bustai, that sounds great, but, right? How do I squeeze in the comprehensive content? How do I place it into the curriculum? How do I actually deliver this where I've got other faculty involved, not just myself, right? Depending on where you are in the process of training NPs. And then you got to assess accountability. How do I do that if I'm not developing it all? Well, again, we have been doing this for over 10 years, okay? But if the profession wants to stay ahead and continue to move ahead, it's going to have to build in some of these principles into the curriculum. And we know that that's turning the corner. It's imminent, okay? It's 2023 and next year is 2024. That's kind of when it's unrolling. So in part 3, okay, again in the series, we're going to teach you and show you how to successfully implement. Again, we are currently already doing this for programs around the country, and we have been doing it. Okay, so this has been our model all along, and we're an advocate of it. So for us, it's very easy. Okay, that's good for you, because if you need help or you need some support at any level, we are here to do it. Because again, we've been doing this for 10 years. We've made it easy for others, and we can make it easy for you. It can be something that's incorporated into the entire curriculum, or it can even be something that students themselves purchase because the school says this is part of our approach. It's like a textbook. Okay, so we're moving away from old ways of doing things to new ways of doing things, and that's what we're going to be covering in part 3, the practical codification of this process into your curriculum. So if you are interested and you're like, look, I'm sold, I just need help, can I just learn about this? Email us here at Curriculum Support High Yield Med Reviews, or scan this QR code and we will be happy to show you. Okay, we can talk to you about it, you can see it, you can experience it, and you can get a pricing or quote to, see if it's relevant and feasible for you, okay, for your students or for your program as a whole. Thank you for joining us. I hope that you found this to be useful. As you can see that we're passionate about this, because we're excited about it, where the profession is going, but we're also excited because this is the model that we do, and we love doing it. And I think that you will enjoy working with us just like so many other programs do already. So thanks for joining us, and we'll see you in part 3.